Te-ai gândit vreodată că o schimbare de imagine poate fi de fapt o formă de vindecare? Frumusețea nu este despre perfecțiune, ci despre echilibru, încredere și armonie între interior și exterior. Invitatul meu de astăzi este domnul dr. Alper Eskalen, specializat în chirurgie plastică, estetică și microchirurgie reconstructivă, certificat internațional și membru al Societății Turce de Chirurgie Plastică. Hello, Dr. Alper.
Hello, how are you?
And I'm so happy to see you again. I mean, I don't
Me
remember
too.
we saw the last time in October, I guess.
Yes, and for the next session, we are waiting for you to Istanbul to my new clinic.
I will come. By the way, how often should I do this procedure?
Lip filler.
Lip filler.
Generally, we are saying to patient that for every each 6 months or 9 months, we are repeating to performing the lip filler, but it's up to the dissolving rate. If it's dissolving so fast, we can do it faster, more recently, but otherwise we can wait for 1 year, even 2 years. It's up to the patient.
And tell me, what are the most popular procedure now among women today?
Most recently, I'm performing too much breast augmentations because I'm doing a very special, very unique technique for the breast augmentation, which is the Preservé technique. In this way, the pain level is much lower than a normal breast augmentation procedure. And also, in this procedure, we are making very little incision, maybe half size of the incision. In this way, the scar is very short if I compare with the normal breast augmentation. And also, after this procedure, the patients can come back their normal life very fast. We can just send the patient to discharging from the hospital from the same day. We are just performing the surgery, and 2 hours later, we can say, okay, it's okay. If you don't have any pain, you can come back to your home. 3 days later, you can come to the control.
And how long is recovery after this surgery?
Even in the same day, you can come back to your normal life. Like you can go shopping after surgery. You can also perform the surgery without general anesthesia. We are talking with the patient during the procedure. Of course, we are doing it in the hospital because we don't want any risk, anything. But we are doing under local anesthesia, maybe sometimes just a little bit sedation while we are performing the local anesthesia, and that's all. It takes just 15 minutes for every each breast. So after 30 minutes, you will have a very beautiful breast, and you can come back 2 hours later to your home or shopping or wherever you want to.
I think this is amazing. And can I ask you about prices?
With this technique, we are using very special devices, and these devices are just for single use. So we are using for one patient, and we are just throwing it. So that's why this technique is a little bit expensive, but all of my patients are saying that it works to just having this technique if they compare with the older technique, because they don't have any pain.
Okay.
8,500 euros.
8,500.
Yes.
Okay.
But in my opinion, no need to change if you have any problem. If you don't have any problem after 16 years, 17 years, just continue to controls on the breast, like regular controls about the breast cancer and everything, and the position of your implants with the ultrasound and the mammography. If you don't have any problems, no need to change it.
Yearly checkups.
Yes, every each year. After 40 years old, it's better to do the checkups. So if you don't have any problem, it can be longer than that. If we need to breast lifting, in the same procedure, we can do the breast implant changing, but if there's no problem, no need to change.
No need. What about rhinoplasty? Because it's the most wanted surgery.
Yeah, the rhinoplasty probably the most performed operation in the Turkey, in the Istanbul. So we are calling the Istanbul as rhinoplasty capital city of the world.
Yes.
Because the most highest ranked plastic surgeons about the rhinoplasties in the Istanbul. So mostly I'm performing a new technique for the rhinoplasty as the preservation rhinoplasty, which is preserving all the tissues which we need to have a natural noses, and also we can just preserve the dorsum, the bridge of the nose. In this way, when you touch your nose, it will be smooth and like the natural nose, but we can just remove the hump. Also, we can just change the shape of the tip. But in my philosophy, in my idea, I always try to achieve the most natural results. And this technique is helping me to achieving this kind of results. But of course, we are having a lot of different type of the rhinoplasty patients, like the ethnical rhinoplasties, thick skin rhinoplasties, thin skin rhinoplasties. So much variation we have, but we can also achieve the desired results by talking with the patients like this, like the online consultations. And also I have a 3D system in my clinic, so I can show to like before and after photos and the videos to my patients. In this way, we can achieve the good results on the rhinoplasty. So the rhinoplasty operation takes around 2-3 hours, and one night they are staying in the hospital. Probably just 1 week is enough for the rhinoplasty patients to stay in the Istanbul in here. Of course, the result will be shown after 1 year, like all your edema will be gone in the 1 year, but after 1 month or 2 months, the patients will have a nose much better than the before the surgery.
Yeah.
One of the most wanted operation from the men is the rhinoplasty, and the second there is the gynecomastia. Generally, I'm performing the gynecomastia operation with the liposuction of the abdominal zone. But if there's a skin excess, like if the patient lost a lot of weight and if she or he has a sagging skin, so the only way to correct it, removing this excess skin, so which is the abdominoplasty. The abdominoplasty patients, mostly the women, because after birth, the abdominal area is getting saggy. So we are doing the tummy tuck surgery, abdominoplasty, and also we are creating a good shape, like the very sportive shape. We can also create some sportive shape, like the 2 packs for the women or 6 packs for the men, with the liposuction and also the abdominoplasty. This operation is not weight loss operation. Okay, this is just body contouring operation. If you have too much fatty tissue in one zone, one point, of course we can give a shape of it, but this is not a weight loss. In weight loss, we are losing all the fat from everywhere.
So, for example, if one patient have up to 90 kilos, do you recommend him first to keep diet to lose weight and after to come for this surgery for lipo?
It depends on the patient. If the patient has a good shape of the body, but just one zone accumulation of the fatty tissue, like around belly, of course we can do the lipo. It depends on the patient.
Tell me about facelift. Tell me what is the minimum age for someone to have a facelift.
So the facelift is really popular in the recent years because the procedure changed and there's really new and good techniques for the facelifting. I also do the deep plane facelifting. I think this technique works much better than the other techniques because we need to correct not only the skin but also underlying tissue. In this way, by doing the deep plane facelifts, we can also lifting all the tissues to the corrected positions. So the lowest age for the facelifting is also up to technique because there are some different techniques. But just if the patient need to remove the saggy skin, we need to do the full facelifting. So the mid facelifting lowest it can be around to late 30s, early 40s. Previously, it was close to the 60 years old, but
Yes.
philosophy has changed because we think that it's better to performing the surgeries earlier. We can't stop the aging, but we can slow it down.
Yes.
Generally, we are performing. If I perform the facelift surgery, the patient stays in the hospital for 2 days,
Okay.
and I want them to stay in the Turkey for 10 days, and after 1 month, they can come back to totally social life. But after 2 weeks, they will be much better, and edema starting to go on, and their face will be like normal.
Lifestyle is important for recovery.
Thank you for asking this, because I always tell the patient that to stop smoking before the surgery. Before surgery, yes, before surgery, I want them to stop smoking for 2 weeks, and after the surgery, 1 month, because the smoking creating some vascular problems. Vessels get narrower, and the body can't get the oxygen, the food for the healing. So the smoking should be stopped. And also, like, the sportive lifestyle is a good for recovery. Of course, the first weeks I don't let my patient to do the sport. Don't let them to go to the gym. And after 1 month they can do. But if they do before the surgery, like keep doing sportive life and healthy lifestyle, it will be better for the surgery's result. And also, it's very important for the scar quality. The self-confidence in our world, it's also so up to our appearance. So there, maybe a patient can be obsessed about nose shape, and if we do the rhinoplasty for her, and if she achieve the desired nose shape and also functional nose, because the deviated noses also have some problems about the breathing. In this surgery, we can also fix the breathing, and also we can correct the shape. So in this way, the patient's social life will be dramatically changed. And I have too much reactions from my patient. They're still sending some stories. Even after 3 years, one of my patients sent me her story, and she mentioned about me, about her rhinoplasty, and she said to me that I'm very grateful of my nose. I really thank you for the doctor, and she shared my names. And this is a good part of being a plastic surgeon.
Yes, I wanted to ask you, because I know many women who from Romania who wants to come for aesthetic procedure in Turkey. So, what are the first steps one patient want to come in Turkey for aesthetic surgery?
It's a good question. Great. So the first step is creating a communication with our clinic. We are creating an appointment for online consultation for the patients who lives abroad from Istanbul. And also, when we do the online consultations, we are just creating an surgical appointment in here. So after that, we are asking to patient that which date they would like to come. It's also up to our program, our schedule, because our schedule is very full, and generally like 3 months, 4 months before, we are asking kindly to our patients to create their appointments, transfer from the airport to their hotel to the hospital. We would like to. Istanbul is very complicated city. We don't want them to alone in anywhere. And also, the hotel is very close to my clinic, just walking distance, maybe just 7 or 8 minutes from my clinic. So it's very easy to come here to walk in. And our clinic is a really in a very good place in Istanbul with all big brands, all big fancy restaurants and everywhere in my streets. So in this district is a very good place to stay or shopping or living in the Istanbul. And after that, when we perform the surgery, the patients need to come to the control a few times before they go. And after that, we can just send our patients with health to the airport.
So they should understand that your clinic have partnership with transfer and also with hotel for accommodation, right?
Exactly.
So they need just ticket plane and
that's all. We have also one partnership with a native Romanian speaker here in Istanbul.
Yes, this is so important. By the way, in all this process, they can keep contact with you on
Sure.
WhatsApp, probably.
Sure. I'm so obsessed about the safety, as you know. I would like them to stay in here till I'm sure that they don't have any problem. I would like to make them happy in all these parties.
And I know you have only happy patients because I follow your activity and I saw your results. That's why I wanted to connect with you and inform
Thank you
our
very
patients.
much.
So the patient have to call the clinic, right? Or the
Yes.
representative of clinic for
The
appointment.
patient should reach us via Instagram or calling the clinic, like in these two ways, or our website, but mostly the DM or the calling the clinic on WhatsApp. We are using the WhatsApp for this.
Yes.
And after that, we are talking with the patients for the online consultation. We are asking their photos, we are asking their medical records, and after that, we are starting to planning for the surgery. And after that, they just need to only buy the airplane ticket, and that's all. The rest of the plan is on us. We are doing the transfer, we are doing the accommodation in the hotel, we are doing the planning all the surgical parts. The only thing they need to do is just carrying back and the coming to this number. It's up to patients if they have like the special disease, like chronic disease or genetic disease. We are asking them to make some consultations in the Romania sometimes, but because it takes time to get some genetic results or something in here, so because they don't want to stay in Turkey longer than 10 days mostly. But the rest of it, for the anesthesia, we also do the checkups, already doing the checkups before the surgery. So no need to doing any checkups before the surgery in the Romania. We will do in Istanbul. Only time we had a patient who has a chronic disease and special diseases. In this time, we are asking them to doing the consultations or some tests in the Romania, and that's all. But before the surgery, while we are doing the online consultation, we are asking all these questions specific.
What do you think is the future of aesthetic? Where is this field going?
The field is going to do the minimal invasive procedures. We are doing the Preservé technique for the breast augmentation. Previously, we are doing the 5 centimeter scars. Right now, we are doing maybe 2.5. Maybe we are doing the 3 centimeter scars. So scars are getting smaller. We are using sometimes endoscopic facelift during the temporal lifting. So we are using some technology devices. So in my idea, the big surgical procedures will turn to the little procedures and like doing some devices and no need to do some big surgeries. But right now, in our technology, I'm trying to using the high quality technology and the the best products in my surgeries. Like I'm using the best products for the breast implants. I'm using the best products for the lip filler.
I see. So less time, less pain, right?
Exactly. Yes.
And at the end, tell me, what would you say to a woman who has lost confidence in her beauty?
I think the confidence is not all up to the beauty, but if they think, and also we agree to correct some part of their body, they can reach us to gain a better body proportion and much more confidence.
Thank you so much.
You're welcome.
Thank you for your time, for your effort to stay with us here. Can't wait to come again there.
I'm waiting for you. It
Yes.
was also a pleasure to meet you again, and this meeting was awesome, and your questions was very unique